We're going to talk about pec minor, specifically how to use perpendicular deformation to mobilize the borders of pec minor. All right, so this muscle attaches onto coracoid process of the scapula, fans down inferior-medial from the coracoid process onto ribs 3, 4, and 5. Okay, so I'm imagining it's this triangular fan-shaped muscle, and if I want to get on the borders, I would be here and here. Okay, so just keep that in mind as we go into mobilizing. So I'm going to put her into this, what IPA calls the fainting princess position. You can imagine why that's called fainting princess. And if I want to start by being on the lateral border, I need to sink under pec major. And so basically the way that I do that is, can you keep your elbow right there, Kelsey? Good. The way that I do that is I get on the border of the ribs. And so if I know that I'm on that level, then I can wrap around the ribs until I run into something that feels fleshy, which is the pec minor, okay? And then I can go along that pec minor and feel where is that hardest infill, and it's right here. And then from here, I can just stay on that with my thumbs, which I probably would recommend. And essentially I'm like bending it, almost like a muscle bending technique, but because I'm going into it perpendicularly and I can get specific on the side of that border, I'm doing a perpendicular deformation technique, okay? Now I could have her raise her elbow up towards the ceiling. That engages that pec minor a little bit, and then drop it down. Good. And again, breathe in as you do that. So I'm coupling breathing with and out and drop down with that mobilization. I could also just keep one hand there and I can have her press up into my hand. That gives me a little bit more control as a therapist, and let it go. Good. And then I can actually localize through her arm to see what puts the hardest infill there. Okay, so that's mobilizing it lateral to medial. Now I also want to consider mobilizing medial to lateral. So I want to sink in, ideally on the skin, if you have access to the skin. And now I can feel along the border of that pec minor where the hard infill is there, and it's kind of all along it, but I would say right here I'm most interested in. And then from here, I can have her start a little bit higher up and then drop down, because then that puts length into that muscle. Okay, so I just want you to go from there to there, Kelsey, right, in that small range. Good. Breathe in as the elbow comes up, breathe out as the elbow drops down. And basically I am just trying to pull that pec minor down and around the ribs. Okay, so keep the elbow up for a second. I'm gonna get back on that border and then drop down. Good. Breathe in as you bring the elbow up and out as you drop down. And one more there. And out as you drop down. Good. And I'm actually doing a little technique where I'm trying to decompress or lengthen that tissue as I drop it down. But that's just what it felt like she needed. You want to kind of always play and see where the hardest infill is. So that's mobilizing pec minor, superior medial, and inferior lateral based on the anatomy of what we know of that fan shape of the muscle belly.